What else might that be? Well, it could be radiation treatment. We might add radiation, or we might use radiation if surgery isn't being done at all. There are lots of times when we say, boy, taking this whole thing out would be a very deforming surgery. Now we need alternatives. This slide calls them high risk / very high risk. We like the term locally advanced. There's not one specific definition of what makes a skin cancer locally advanced, but it's kind of one of those, you know it when you see it. When it's so big that the surgeon says, I can't get this whole thing out, or I can only get it out by causing a lot of problems, both for the patient and for the reconstruction, the healing. That's when we're talking about locally advanced. Usually that's at least going to be 4 or 5 centimeters in size, but in some places, even a small tumor, much smaller than that, can be a real problem. And fortunately, we now have alternatives besides surgery for some of the worst problems that we used to face from skin cancer. Radiation therapy can be one of them, and systemic therapy is the other. Before I go on, just in case anyone's confused, on these NCCN slides and guidelines, there are all sorts of footnotes, letters I, R, L. These all refer to the fine print somewhere that explains exactly what they mean. So don't be confused about that. It isn't RTI or systemic therapy are. It's just saying something like, see guidelines on systemic therapy, see doses for radiation, see this section for when we think radiation would not be feasible.